Hi guys, Heather here. Today's topic comes from Rosalinda, also known as Tooth Crazy. So hi Rosalinda, and thank you for the topic. So we're going to be discussing IVs and all the crazy things that can happen with these babies. Like, why does it seem some days they're constantly screaming at us? It makes you want to like throw it out the window or shove it against the wall, right? That just wouldn't be appropriate. And the windows don't even open. So a few reasons why your pump might be beeping at you would be because it thinks your IV fluids are out, there could be a kink in the tubing, there could be air in the line, or your patient's IV catheter is occluded. So one of the most common types of occlusion is when your patient has an IV right here, in the antecubital. And why? Because they're gonna bend that arm. No matter how many times you tell them not to, they're gonna forget. So what you can do is put an arm board underneath, and that will help a little bit, except for on the confused patients because they just don't know why the arm board is there. So if that's not the case, then your IV might have to be flushed with normal saline because some of those IV solutions contain dextrose, sugar, which can kind of clog the lines a little bit. And so if you flush it with saline, then it opens up the line and keeps it patent. And that's what we want, a patent IV, right? Because we don't want to have to start another one. You know, I have this pet peeve of mine that happens when a patient goes downstairs for a procedure and then they come back up and their IV pump is turned off. So what does that mean? Nothing's flowing through the IV, right? Everything's just kind of sitting there clogging up the IV, so you go to flush it, it doesn't flush. And I'm like, okay, that's not very cool because heck, they don't care. They don't have to start the IV. I do. What is a PICC line? A PICC line is a peripherally inserted central catheter started by a certified PICC nurse. You have to be certified for this. And usually it is started in the antecubital, and it's a long catheter that goes all the way up the arm into the tip of the heart. And these patients have these catheters usually because they are a hard stick, or they're on TPN because that can be harsh on the veins, or they have to go home on like 6 weeks of antibiotics or so, or a home health nurse will come in and start these antibiotics like once or twice a day. So it's kind of convenient for them. Personally, I love PICC lines because you know that your IV is not going to infiltrate on you. They usually have like 2 or 3 lumens where you can hook up 2 or 3 different IV solutions at one time. The only downfall is us nurses, we have to draw the blood because lab won't draw blood from the PICC lines. But it's good for the patient because then they don't have to be stuck. But they're super duper convenient and you know nothing's going to go wrong. You just have to make sure your patient's not going to pull it out. And then there's the central line, which is usually in the jugular or the subclavian right below the clavicle. These are usually started in the ICU because the patient may be on so many IV drips and fluids that they don't want to irritate the veins and have the IV poop out on them with a regular IV. And they're also convenient because they have 2 or 3 lumens where drugs can go in at the same time and you can draw blood from them. So super, super convenient. Since the ICU patient can be hooked up to so many things like heparin and insulin, TPN, antibiotics, and cardiac drugs, they'd have to have like 5 peripheral IVs because these drugs can't really be infusing together. So that's why the central line is a really good idea. What is an IV push? An IV push is a small amount of drug, usually 1 to 5 mils, pushed by a syringe into the IV. Usually over 1 to 2 minutes, but the exact information per drug can be found in your drug book. And if it can't be IV push, then the pharmacy will send it up in an IV bag, like a piggyback or a secondary line attached to your main IV. For example, potassium, that cannot be given IV push because it will cause cardiac arrest, so they send it in an IV bag. Potassium can be pretty irritating to the veins, so be kind to your patients and have lidocaine ordered with your potassium to help ease their pain, and then they won't be complaining to you about how much their IV hurts. One other very important tip to remember when you're hanging a piggyback is you have to hang it higher than the main IV because it infuses by gravity. If it's level or below the main IV, then basically your main IV is going to be infusing and not the piggyback. And also, make sure you unclamp it. The roller clamp, unclamp the piggyback because sometimes that gets missed and then the antibiotic won't even be infusing. So what I like to do is I kind of like to stand there and watch it drip into the drip chamber to make sure, that I know that antibiotics infusing before I leave the room. Well, that's it for today's IV questions. Thanks everyone for watching. Have a great day and I'll talk to you soon, Kay? Bye.